Do you need help navigating a health insurance claim? The Health Education and Advocacy Unit at the Maryland Attorney General's Office may be able to help. Hi, welcome to another edition of MIA Minutes. I'm your host, Joe Spiatko, Communications Director here at the MIA. Joining us today is Kim Camerata, Senior Assistant Attorney General for the state of Maryland. She works with the Health Education and Advocacy Unit, where she's the director. Kim, thanks for joining us today.
Happy to be here.
So I guess we'll just start right off the bat. What is the Health Education and Advocacy Unit?
So the Health Education Advocacy Unit was established by the General Assembly in 1986 to assist consumers who had medical billing, medical equipment, or medical records disputes with their healthcare provider. We were later tapped as the agency to assist consumers when the Maryland General Assembly passed its Appeals and Grievances Law. So we were tapped then to help people with that process as well.
What kind of assistance can a consumer expect when reaching out to your unit for help?
So I know this podcast is largely about giving consumers information about how to address the appeals and grievances process when the health insurance carriers deny coverage or all a part of someone's claim. And we will certainly talk about that in just a minute. But since I have this audience, I just really wanted to let consumers know that the Health Education Advocacy Unit can help with those medical billing, medical equipment, medical records disputes if consumers have those disputes. We do that through a voluntary mediation process, and we're successful in helping consumers resolve those disputes more than 50% of the time when they reach out to us with those kinds of problems. It's those collections and billing disputes, they often stem from health insurance claim denials as well. And so we can help consumers who have private health insurance when their health insurance company denies all or part of a claim.
Tell us how that works.
So when an insurance company denies coverage, consumers have a right to appeal that denial internally with their insurance company first. They have a right to know why the insurance company denied the coverage, and they have to give the details to the consumer about that. And consumers can, again, challenge that denial. For example, if a consumer's healthcare provider says you should have an MRI, their insurance carrier may require pre-authorization of that MRI. And the insurance company might say, no, we don't believe that MRI is medically necessary. Well, the carrier has to explain why that is, and the consumer has a right to challenge that, and we can help with that. We'll write to the carrier, we'll get an explanation as to why the carrier doesn't believe it's medically necessary, and we'll reach out to the consumer's healthcare provider to get an explanation as to why the healthcare provider believes it is necessary. And we will reach out to that carrier with that appeal. If that challenge isn't successful, under state law, the consumer has a right to take that question to an independent medical review board or an external reviewer, independent from the insurance company. And that's called an external or independent review. Federal law also offers external review rights, but only for denials based on medical judgment. We can help the consumer get to the right place when they have that next step they have to take with the external reviewer. For Maryland regulated plans, the request for external review goes to the Maryland Insurance Administration, and the administration has medical experts who will review the case, make the final decision about whether the coverage should be provided for that MRI, for example. If the plan is not a Maryland regulated plan, the request for external review, where that goes depends on certain things, but the HEAU will help the consumer get to the right place and make sure it gets to the appropriate external reviewer.
So in a recent podcast, we talked with the MIA Appeals and Grievance Unit. Can HEAU help a consumer when the MIA Appeals and Grievance Unit cannot?
Yes, we can. So if the consumer is covered by private insurance. So we don't handle Medicaid appeals or traditional Medicare cases, although if consumers come to us with those kinds of complaints, we will be sure to get it to the right place. We all work together, the MIA, the state health insurance program, the Medicaid program, we all work together to make sure the consumer gets to the right place. And if the MIA does not have jurisdiction and it's a private plan, then we can help. A lot of people don't realize that the MIA doesn't have jurisdiction over a lot of employer-provided plans. We help consumers that are in those types of plans.
So what if a consumer has an emergency? Do they have to go through both these steps you've outlined?
If it's a true emergency, consumers can seek an immediate appeal, external appeal, by calling the MIA 24/7. And if the MIA doesn't have jurisdiction, if it's one of those plans where they don't have jurisdiction, they will get it to us as soon as possible.
Okay, great. Can you give us an example of how HEAU has helped a resident?
I could give you lots of examples. Our team works very hard every day to help consumers, but one that sort of sticks out for me was a family with a 12-year-old child who had a growth hormone deficiency. That child had been getting growth hormone injections for 3 years. The insurance carrier for that family required reauthorization of those injections each year. And in year 4, the plan denied the injections as not medically necessary. That family reached out to us. We worked with the family through the internal appeal. Unfortunately, the internal appeal was not successful. So we sought that external review with that independent provider. And that independent review organization overturned the denial, saving the family over $90,000.
Wow, that's great. So are these services free?
Yes, there is no cost to the consumer for reaching out to us. So we definitely want consumers reaching out for help.
And why is it important that consumers know their rights when your health insurer won't pay for healthcare services?
Well, because carriers routinely deny services, even when they shouldn't. Last year, when consumers asked for HEAU's help with their appeal, their decision to deny coverage, we were successful in getting that decision changed 62% of the time. So consumers should challenge those denials when they think that denial is wrong, and we are here to help. And we know, it's not uncommon for these denials to come when a consumer is really struggling with medical issues. That's why they're seeking help in the first place. And we can help with that. If they turn it over to us, we'll work with their provider and we'll work with their carrier, because this is complicated stuff. And that's why our agencies are here, is to help those consumers.
Okay, and as we close here, Kim, how can consumers know to contact you? What's the best way to reach out?
Well, right at the end, I believe we're going to have a slide at the end of this podcast with our contact information. The consumer should also know that when their insurance company denies coverage of their claim, that denial, which is often an estimate of benefits form, sometimes it can be in form of a letter, it has to include information about the Health Education Advocacy Unit and how to contact us. It's also supposed to require information about the Maryland Insurance Administration as well. So if they get that denial, consumers know that they should be able to find that information on that denial document.
Okay, you think there's anything else that we didn't cover that you think someone should know about here as we wrap up this edition of MIA Minutes?
I think there's so many things we could tell consumers about because it is really complicated. And so to try to explain all of that in a short podcast is really hard, which is why we just urge consumers to, if they have a question, to reach out. We have a hotline number that'll be on the slide. They can call our hotline first just to see if we're the right place. If we're not, we'll get them to the right place. But if they're denied, they should, there's a process for them to challenge that, reach out to us, and we'll do what we can to help, and we'll get them to the right place.
Okay, once again, we've been visiting with Kim Camerata from the Attorney General's Office Consumer Protection Division, the Health Education and Advocacy Unit. We'd like to thank you so much, Kim, for spending a few minutes with us today to provide our listeners and viewers with this important information.
Thank you for having me.
To contact the Office of the Attorney General, Health Education and Advocacy Unit, call 410-528-1840 or toll free at 877-261-8807. Email heau@oag.state.md.us or via the World Wide Web at marylandcares.org, marylandcares.org. To reach the Medical Necessity and Emergency Appeals Hotline, call 1-800-492-6116, 24 hours a day, 7 days a week. You can also visit our website at insurance.maryland.gov. That's INSURANCE.MARYLAND.gov.